Right. Well, thank you. Well, a little bit earlier, Dr. Zhao had mentioned that innovation doesn't just come from high-income countries, and we just heard the importance of more for less, but also having innovation really come from the communities. And so we're going to really focus on that in the next panel and looking at the innovation boom that is happening in Africa and looking at some examples of how we can really scale that. And I'll invite Catherine Cheney to the stage to lead the discussion.
All right, I want to make sure, oh yes, I see all of our speakers here. I'll go ahead and welcome our speakers to the stage as I introduce them. And we're going to be narrowing in on one specific aspect of innovation, which is supply chain innovations. So I'll introduce that topic as I introduce our speakers. Please come and join me. We have Mara Hansen-Staples, who's the founder of Salient Advisory. And she'll be, can I give you a hand? You got it. Okay, come on over. Next, I'll invite David. Chen, who's the co-CEO of Kapsule. And while I typically discourage panelists from introducing themselves because we don't want to spend too much time on introductions, given that this is about entrepreneurs and health tech innovations, we'll do quick intros because you guys are pros at the elevator pitches, keeping it short. And next, I'd love to welcome Oghenetega Iortim, who's the managing director of Figorr. So let me introduce this topic as we take the stage. This topic of health supply chains is something that Devex has followed very closely. You have a lot of large players in the global health ecosystem, like USAID, wanting to change the way that they procure and distribute health supplies, and talking about how they want to partner with local innovators. But often, this pushback is, there's no pipeline, right? Except here, we see there is a pipeline. There are some really exciting innovations happening on the African continent, so we'll hear about some of them in a moment. And then Mara is behind an effort called Investing in Innovation Africa, or I3 Africa, which we'll talk about, which works to support the commercialization of 60 promising African-led supply chain companies like the two you'll hear about. So what I love about this session is we are talking about the need for partnering locally, the need for locally developed innovation. This is a real example of how do we connect the innovation that exists with this larger global health ecosystem. So to start, as I mentioned, while I don't typically encourage introductions, I do quickly want to hear from Tega, from David, and then from Mara. Tell me what you're working on at your organization and how it connects with this theme of actually supporting Africa's health innovation landscape. Tega, we'll start with you.
Thank you. Sorry. At Figorr, what we're basically doing is we're leveraging data to figure out the loopholes across the cold supply chain. So answering pertinent questions such as where is the existing infrastructure, efficiency of existing infrastructure that enables sharing, as well as leveraging same data to get the insurance companies to play a role in underwriting perishable risks, which they initially were not doing.
Great. See, the elevator pitch. I love it. David.
Hello, everyone. I'm David Chen from Kapsule. And Kapsule is a healthcare data analytics company. What we essentially saw is that the healthcare system in Africa is very fragmented, and there's no easy way to get a comprehensive view of what's happening across many countries. So we are building that infrastructure that enables data to be easily shared and accessed across the continent.
Mara, tell us more about how you're working to support entrepreneurs like David and Tega.
Thanks, Catherine. So our organization, Salient Advisory, with our partners in the room here from the Selena Group, funded by the Gates Foundation, MSD, Cencora, Chemonics, and Microsoft, launched a program 2 years ago to select and support 60 African-led health tech companies innovating in supply chain, like the two you see on the stage today. Collectively, after 21 months of support, these innovators are reaching 115,000 providers across the continent with tech-enabled models to deliver products, services. They're tracking over 250 million products. So although startups in Africa may be a small part of the market, they are no longer insignificant. And what we do at I3 is just introduce them to customers. So we realized there was a huge disconnect between the global customers funding healthcare supply chains like USAID, but also Gavi, also Merck, Sanofi, others. We take amazing leaders like the two you see here today and try to introduce them to customers who can power their impact at scale.
Well, the World Health Assembly is a great place to do that, and I know you're actively doing that. And yet, it takes more than just knowing these people, right? The introductions are helpful, but there are still structural barriers to scale that you as entrepreneurs face. And I know that you at i3 are thinking about how to overcome these barriers. So can you talk us through that? Like, as entrepreneurs right now, even if you're in the rooms with all the right people, what is preventing you from partnering with them and working at the scale you want to?
So from my perspective as an innovator, I think one of the major challenges that we face is the larger organizations actually committing to investing in Africa, particularly in the private sector setting. Usually when you're looking at health programs or health data in where we stand, everything is focused on the public sector setting because that's where the bulk of the treatment is happening. But when you think about it from an economic standpoint, it's actually the private sector which is leading a lot of the spend and is making these multinational organizations more aware and more committed to the fact that there is commercial opportunities of delivering healthcare, whether it be through products, whether it be through services in Africa. And I think that advocacy part and the education part is something that we have to focus on a lot.
Tega?
Yep, I completely agree. I think what we're also finding on the ecosystem, within the ecosystem, is that there's a lot of policies with good intention, but are now serving as barriers for entry for local players. I'll give you an example. There's a particular certification that we require, and when I looked at that document was last updated in 2015, and a lot of it is outdated. But without those certifications, you can play a role in that ecosystem. And for the African healthcare space, it's difficult for you to scale without partnerships with the government. And, the last panelist, we were talking about financing and governance. But what also happens is that a lot of the finance that comes into the African continent to finance operations in the healthcare space is largely donor-led. But a lot of this finance that also comes in with a lot of clauses, right? And these clauses limits the implementation of local solutions. And I'm seeing that as a major, blocker to scale for local innovations. And I think it's something that we really need to look at.
Tega, I want to ask you about something specifically that we talked a bit about, and I think it would be helpful to discuss with this audience. Because again, here we are at the World Health Assembly, and one of those barriers for entry includes the WHO's Performance, Quality, and Safety Process, or PQS. So as an entrepreneur, you know that, you throw that acronym around, I'm sure it might be less familiar to people in the room. Can you explain why is that a barrier? Why is that an example of where there could be progress made?
Yeah, so for the WHO PQS, it's an important document, right? That creates standards for different technologies or solutions to be implemented within a country, which is very key, right? But I think the process in getting that is really lengthy, right? And as most African businesses, you find that, well, as a technology startup, you find that you have a 12-month runway, a 6-month runway. How long do you have to survive before you can get your PQS? But I think that, when you look at the documents, you see that there are certain steps and processes or guidelines, right, that you have to follow. I think if you follow those guidelines, you should be able to do business, but you still can't. Until you get that stamp, you can't do business or you can't scale. So irrespective of how much investment, how much effort, how much work you've done, that limits your growth, especially for us, that deal with tracking of temperature-sensitive products.
Yeah, entrepreneurs can't necessarily afford those lengthy delays. Go ahead, David.
Yeah, I just wanted to add to that, that's one of the primary reasons why Kapsule initially solely focused on the private sector, because we saw that the market dynamics allows us to create value for our customers, get referrals, get revenues, and then we can demonstrate the real value of our product and innovation that we're developing. If we were to focus our energy on many of the public sector institutions, they have their requirements, they have their processes which don't have a guarantee of a payoff at the end of the day. You're not improving your product, you're not building your brand, and it's very, very high risk. So unless you have very deep pockets and can wait a long time, you have to be very prudent about how you spend that time.
Mara, I want to go to you, and it looks like you wanted to comment, which you should. And I also want to ask, how is I3 working to address some of these challenges? And what are the limits of what I3 can do, where you'd ask others to step in?
That's a great question. I think the interesting example that Tega provided, Figorr has already been serving the National Primary Healthcare Development Agency at scale, tracking all EPI vaccines in the country, COVAX vaccines, and the HPV vaccine for a number of years, 100 million products tracked. When they want to continue this partnership and other donor funding comes into play, the request for PQS comes to the table and becomes a blocker to continued scale. So one of the things that I3 does is give flexible financing to every company we support. That helped jumpstart the PQS process. It was $50,000. It's quite a lot of money. But at the end of the day, and that's in process, and I think it's a really important quality check. But I think it's a real call to action to us in the global community to think about where do our intentions to support local innovation, job creation, where are they stymied by our procurement processes, by our regulations, and by the way we partner? And I think it's really important that we ask ourselves that question urgently now if we want to meet the requests of the Nigerian government, the requests of the Kenyan government, the potential that innovators like these two bring to the table.
So, of course, in this session, we're talking about supply chain innovations. I want to hear a little bit more about specific challenges you're facing and how you've tried to work around those challenges and overcome them. And the support of I3 is part of that. And as we have that conversation, what is unique to you as a supply chain innovator? And what are the sort of transferable lessons for anyone working as an Africa-based innovator? I mean, the challenges you face, entrepreneurs across different aspects of health are facing. So what is specifically a challenge for you as a supply chain innovator? And what are challenges that are sort of across the board, something entrepreneurs will face?
I'll kick this off. So I'd say there's two major problems that we face as supply chain innovators. They actually feed into the eventual development of Kapsule's business model. But the first one is the data fragmentation. When you're working in a supply chain where there's no real standardization, everyone's using their own systems, some are custom built, some are enterprise software, some are open source, and some are just random hodgepodge of different tools that are available. And for us, what we had to do is find out a way to really see the wood from the trees. How do we actually get the valuable information that is sitting within that data, regardless of the format that it's in? And what that eventually enabled us to do is see that there are some truths that exist regardless of the format that the data is being collected in. And Kapsule's business model developed from that, because what we saw is that if we can then take those truths and create a standard process and a standard data lake, what we call it, or a standard place where we can put that data, we can then start aggregating data from many different countries, many different facilities, and view what's happening at a macro level without actually losing any of the detail that you get at the micro. And that's where our business sort of developed from that. So as an entrepreneur, we always look for the opportunities and challenges. And for me, it was the challenges that led to the bulk of our business. But over to you, Tega.
Yeah, I think the technology ecosystem in Africa kind of faces very similar challenges.
No matter what aspect of it you're working in, yeah.
Either in health, supply chain, or whatever it may be. I think there's capital challenges. When Africa was celebrating, raising 5 billion, I think this was last year or 2 years ago, cities across the world were raising way more than 5 billion. I mean, the tech ecosystem in some small city across Europe was doing that. So you have limited capital to grow. Mm-hmm. And the implication of that is that you have to find a way to survive, mm-hmm. right? Which also means, how do you spend? Where do you find the opportunities? And this is why, it's also a little bit difficult working with government or working with, larger organizations, because sometimes you can't provide a service and wait 6 months for payment, right? And that also limits how fast you can grow. So there's the capital aspect. I think also as you're growing as a business, you start to find a people problem. At the early stages, you find a lot of resources, a lot of talent, but then you need to manipulate data, you need actuarial services, you need so on and so forth, and it becomes incredibly difficult for you to find those local talents. And then you may want to explore, and then you hear that, okay, you have to pay this guy like 200K a year. And you're like, who am I going to get that money from? So those are some of the major challenges, but I think what we've been able to do as a business has been to, take it, one day at a time, ensure that we also keep a very good runway. Also, look for good opportunities or, available opportunities. But I'm also blessed to come from a country, Nigeria, where I think the government is really willing to adopt. But I think that, and one of my key messages here would be how can, the global players who finance such initiatives kind of, allow us, make this partnership work.
Absolutely. Well, and since so much of it is about government partnership, it really depends on the country in which you're working, of course. I want to close with Mara. So we've heard a little bit about I3. Kind of back to the comment I started with, that often the pushback you get from the global health community is there's no pipeline. Again, we're hearing that there is, but there are still real barriers to linking these groups up. So just a final thought from you on where you hope to see this space head, and again, what others can do to advance this space and support these innovators.
Thanks so much, Catherine. Through I3, in our first 21 months, we've made over 450 targeted introductions between the companies we support and customers. They've signed 109 deals so far, and we have our first over $10 million deal we facilitated under discussion now. I think for us to $10 million is a drop in the bucket in what's spent in global health today, let alone in supply chains. So what feels like success to me is that Gavi, the Global Fund, the Gates Foundation, the Rockefeller Foundation, others in the room who are purchasing large healthcare services, not only the governments who are doing this today, and I think in many instances are on the leading edge, but that all of the other powers that be that are purchasing services in both the donor, global health agency, and industry sectors are contracting with the health system leaders of the future in Nigeria, in Kenya, and all across the African continent, because I think this is the way we help create jobs and deliver services, and hopefully it's more for less.
Thank you, Mara. Well, please join me in thanking our panelists as I welcome Kate back to the stage. Thank you.